My name's Dona Hasou. I graduated from AUA in 2013. I'm right now a second-year resident in internal medicine and pediatrics at the University of Illinois College of Medicine in Peoria. One of my first true medical experiences was shadowing a cardiothoracic surgeon. And so I got to watch open heart surgery, and I remember the surgeon holding a patient's heart in his hand, and it stopped beating and then tapping it to restart it again. And so that memory has always been very clear in my mind about that kind of trust that had to be earned for him to reach that point in his career. I did my rotations in internal medicine at Harbor Hospital in Baltimore through AUA, and it was a fantastic experience. Residency is a lot like medical school in the sense that you still do rotations, especially when you're doing internal medicine and pediatrics. You have to go through every specialty. So a day in the life can change drastically. Typically, wake up very early in the morning, rush out the door. I check my patients' labs in the morning, check their vitals. Then I go and I see each of my patients individually, and I start by talking to their nurse first because they had been there all night, or the daytime nurse who got report from the nighttime nurse, and ask if there were any concerns that the families had brought up, order medications as needed. If their blood pressure had been too high all night, I can increase the dosage of a medication. I'll round again with my team, whoever it may be, the attending, whether there's interns, medical students, and then we make the plan for the day and just follow along with the patient throughout the day. So I'm in my second year, so I start applying for fellowships next year. I'd like to be a pediatric heme-oncologist with a focus on survivorship. And so what that is, I'm doing internal medicine pediatrics, and I don't want to lose the adult aspect. With pediatric heme-onc, I will take care of kids with cancer, but also follow them as they grow into adulthood. Children don't really know how to tell you what's wrong or what hurts, and so you have to use a lot of verbal cues. In those situations, you realize how much you understand something when you're able to explain it to a child. But I think also being a pediatrician helps me be an internal medicine doctor because I learned to take nonverbal cues a lot more. There's been a lot of stronger strains of viruses that we've seen this past year. And so the number of patients we've had is through the roof. You can definitely see a physician shortage. I'm practicing right now in the Midwest, and that's probably one of the areas of biggest need for physicians right now. And it's a great place to practice medicine because the medical community is so strongly knit together. My advice for any student, regardless of what field you want to go into, is just show up and be there to work. If you show up and work hard, people notice.